Hi, everyone. We'll be starting very soon. We're just letting the webinar start so that it populates everyone, all the attendees. So we're just going to be a couple more minutes and we will start. Okay. Well, we'll do an introduction, small introduction of what's happening, and then I think more people will be joining us. So first of all, thank you all for coming and joining us. This is the second talk of the SEVI research talk. SEVI is the Social and Economic Vulnerability Initiative. It's an initiative that's housed in the Center for Regional Sustainability at SDSU. SEVI focuses on issues related to homelessness and by default housing. So homelessness and a lot of issues that kind of rotate around homelessness or affect homelessness or vice versa. Homelessness affects those issues. SEVI is a interdisciplinary approach, if you want, or an initiative where it combines people from political science, criminal justice, music, art design, engineering, public administration, and other discipline as well, all of them coming to understand this issue from a bigger or more comprehensive perspective. And so that's what we're trying to do with SEVI. Today we have two SEVI fellows, and both of them, like the work that they have done was supported by SEVI, and it's really very interesting and very important work that they are doing. Just a couple of things before I introduce our panelists. First, and an important thing is if you have any questions, please put the questions in the Q&A. And then we will be able to answer them. The second thing is we're recording, so just that's for your information as well. With that, these are like just the basic housekeeping. With that, we'll start this talk, which is entitled Community Acceptance and Opposition to Homeless Serving Facilities with an S, I apologize. And we have the two authors, Dr. Megan Welsh and Dr. Brian Adams. Dr. Welsh is in the School of Public Affairs. She's an associate professor in criminal justice. And Dr. Brian Adams is from the Department of Political Science, and he's a professor of political science. He's more than one professor, he's a lot of professors. So, and with that, oh, of course, we do have our graduate assistant, the wonderful Carmen Hernandez, that has been helping tremendously. And this is happening with all her efforts. So thank you, Carmen. And with that, I'll send it to Dr. Welsh. Dr. Welsh.
Thank you so much, Dr. Abdel-Samad. It's wonderful to be here with you all today to talk about the important topic of community opposition to homelessness and homeless serving facilities. I will go ahead and share my screen. And I can no longer see anyone. So, oh, there you are, Muna. Can you give me a thumbs up if my slides look okay? Wonderful, thank you. So hello, everyone. I'm excited to be here with you all today. I am presenting, I'm gonna start talking first, and then my colleague, Dr. Adams, will jump in the second half of the presentation. We're excited to share this research project with you. I want to acknowledge our two other authors on our public report of this research. And they are both a former and a current graduate student. So Rebecca Riddle graduated with her master's in criminal justice and criminology recently. And then Nicolas Guitierrez has also been an integral part of our research team, and he is currently a master's of criminal justice and criminology student. So the context for what we're going to talk with you about tonight is California's housing crisis and San Diego's status within that crisis. And we're going to talk to you tonight about how people are making sense of homelessness and homeless serving facilities in their community, and really trying to unpack and understand where the sources of opposition come in terms of community-based responses and interventions to homelessness. So folks who are living in California, living in San Diego, you are probably aware that we are experiencing a housing crisis. The housing is incredibly expensive. The median sale price for a single family home in San Diego, I believe, is approximately $825,000 currently. Down in the bottom left-hand corner, you can see some numbers from a recent report from the National Low-Income Housing Coalition that gives us very unsettling statistics, like it takes 112 work hours per week at minimum wage to be able to afford a 2-bedroom rental home here in San Diego. Just yesterday, a new report, a research report from Zillow came out naming San Diego as the worst place in the country for Black renters, citing a very high level of rent burden that Black San Diegans are dealing with around housing. Zillow estimates that Black renters in San Diego spend more than half of their monthly income. I believe the report cites about 52% of their monthly income on rent. And this is far higher than what we would want to see. Zillow has been doing some great research in this area. So one of the other headlines, homelessness rises faster where rent exceeds a third of the income, really connects this housing affordability crisis to our crisis of homelessness and housing deprivation. And we know that these issues have only been made worse during the pandemic. A report from the regional task force speculated that the number of new homeless people in the county doubled in the first year of the pandemic. And yet, while we can acknowledge that we have a housing crisis and that homelessness is growing and only getting worse, we have not reached anything close to a consensus on what solutions should be. And in fact, we've had several high profile focusing events here in the San Diego region where plans and proposals to implement affordable housing projects in our region have been met with a whole lot of opposition. And part of this, the last image on the slide that I'll mention in the bottom right corner, part of this opposition, as we're trying to unpack the drivers of the opposition, a lot of this manifests in social media now, right? And so before we gave this talk a couple months ago, just that day, right when I was preparing for this presentation, one of my neighbors on Nextdoor, Carol, posted about how in my neighborhood of Golden Hill, that it seems to be attracting more folks to the area. She urges people to use the City of San Diego's Get It Done app to file complaints against people experiencing homelessness in our community. And she really uses this narrative that you will hear in our data tonight. She says at one point, all it takes is one person to start a trend, which we don't want. So this kind of magnet idea that if we start providing services in our neighborhoods, that it will only attract more homeless folks to our community, and that is something that we don't want. So with that kind of context in hand, Brian and I and Rebecca and Nicolas embarked on a research project last year. This was a project that was conceived and designed and developed in, I don't know, December to February of 2020. And then we collected data in the summer of 2020. And you all know what happened kind of in between our planning and our execution of this project, the COVID-19 pandemic, namely. And so we were able to move everything online and still gather the data. So we were able to stick with our original plan of using an electronic survey and using local community planning groups, their mailing lists, as well as Nextdoor. We posted and disseminated a survey through Qualtrics where we sought responses to a brief survey about folks' perceptions of homelessness and homeless serving facilities in their community. And then at the end of that survey, we asked folks if they would be willing to participate in a follow-up focus group with us. So that was where the shift had to come in, pandemic-wise. And so we were able to conduct 7 follow-up focus groups by Zoom last summer. And so our total number of respondents there was 34. And if I didn't mention it previously, we had just over 250 survey responses. And the last thing I'll say about that is it was really nice to be able to conduct the survey and then use those responses to try to put into focus groups based on kind of the perceptions that they told us about in the survey. So we assigned folks to focus groups with the idea of trying to maximize a diversity of views or opinions. So we took folks' initial survey responses and just kind of roughly categorized them as seeming to be receptive or open or feeling positive about homeless serving facilities in their community versus those who expressed views in opposition. And so we tried to put those folks into groups together to try to hear what the conversations, would emerge. So some demographics from our data collection. This breaks down demographics for gender, race, ethnicity, and housing status based on our survey respondents and our focus group respondents. And so what I did is I just went through and highlighted in that kind of orangey yellow color what the largest group was represented demographically. And so the majority, close to 2/3 of our sample close to 2/3 of our sample for gender and housing status were female and homeowners. And more than 3/4 of our sample for both the survey and the focus group identified to us as white. So the views that we are going to share with you today, and our sampling was purposeful to achieve this effect. We wanted to be able to hear from people who identify as owning homes. We recruited through, as I mentioned, community planning groups and Nextdoor. So we were trying to sample for folks who likely not only have certain perceptions of what's happening in their community based on their status as homeowners, but who are also to some extent civically involved. And that's how we arrived at the sampling through the community planning groups and Nextdoor. So our sample is not representative of all San Diego residents at all, as you can see from these demographics, and that is purposeful for the point of the research. So, sorry there, I'm having difficulty with my slides. So to summarize a little bit of what we found in our brief survey, we asked folks what they perceived to be the driving causes of homelessness. And so what this bar graph breaks down for you is the frequency with which folks believed that these different causes, rarely, occasionally, or frequently, were causes or drivers of homelessness. And over on the right-hand side, you'll see I've put a few red arrows just to kind of cue you into some of the patterns that we saw both in the survey and later on in the focus groups. So in the top line of the bar graph, you'll notice that this was, I think, one of our strongest and perhaps most stunning findings is that 85% of our survey respondents believe that drug and alcohol abuse is a frequent cause of homelessness. And in the next slide, I'll show you that that doesn't really track with the empirical evidence that we have. And you'll see similarly for mental illness, there is a very large group of folks, more than 80% believe that it is a frequent driver of homelessness. And yet, ironically, the last red arrow there, a much lower proportion of folks, just over half, 54%, believe that homelessness is caused by an inability to find affordable housing. So we really wanted to unpack these perceptions a lot more in our focus groups. And so the next few slides that I'm going to walk you through, and then I'll hand it off to Brian, really kind of summarize some of these themes that started to emerge in our survey and then really came out in the focus groups. So as I mentioned from the previous slide, you know, well over 80% of our survey respondents believe that substance abuse is a main cause of homelessness. The estimates from the empirical data are more like 25 to 40% of folks in the US experiencing homelessness are living with an addiction to drugs, alcohol, or both. So I want to identify this as an opportunity, and we'll circle back to this at the end, as an opportunity to dispel some myths and stereotypes about people experiencing homelessness. And so we hear these stereotypes in these focus group passages. One person told us, I see homelessness mostly as a mental illness and or drug and alcohol problem. The homeless that are extremely visible in my community are true vagrants, crazies, petty criminals, drunks, and drug addicts. So there is a whole lot of labeling and stigmatizing of this population happening in that passage. Another person states they are frequently violent, high or drunk, and believe there are no consequences for stealing, urinating or defecating in public, open alcohol, and drug use. And so I just want to cite a few more kind of research reports that really point us to the fact that with any labeling of folks, we have to remember that there are pieces to the pie here. And oftentimes we paint the homeless community with a very broad brush. And we see this in these narratives, whereas the empirical literature really points to the fact that there are portions of the homeless population that are dealing with these issues, but it's not everyone, right? So 1 in 3 to 1 in 4 people, it's estimated, are living with a serious mental illness. Whereas on the other hand, as I reviewed at the outset, affordable housing is a crisis that a lot of folks are confronting, right? And our respondents, only about 54% of them said that that was a frequent cause of homelessness. Some of our focus group respondents had very nuanced and complex understandings of homelessness in contrast to the previous slide. And so again, I want to highlight these passages as opportunities for us to disseminate better narratives, more accurate narratives, and to dispel stereotypes around homelessness. And we can learn from what some of our participants told us. So participants talked about being aware that folks who are homeless in their community are working poor or just trying to find a place to be, that a lot of folks are probably living in their cars and more recently may have experienced eviction and are still working. Another respondent described engaging in direct charity out of a belief that homeless folks are still their neighbors, even if they're disruptive. And so this person really described engaging in that charity and then also trying to dispel some myths in her own community. And so she told us there are a lot of reasons why folks become homeless. And so one thing that bothers me is this blanket thing. Well, they're all drug addicts. No, they're not. And they're not all mentally ill either. There are lots of reasons. And so we did hear these narratives in our focus groups as well. And then lastly, folks were aware, kind of based on the title of the slide, one of our respondents called it broken systems, not broken people, right? That we need to be looking to our systems of social welfare and social services and see where those are breaking down rather than blaming folks for their circumstances. And to that point, one participant talked about their awareness of the linkage between things like sleep and mental health. If you're not getting a good night's sleep, you're going to feel like crap. Do that for 3 nights in a row. Now do that for a week in a row. You don't think straight. And so your behavior is not right. And you start mumbling to yourself. You start seeing things. You start talking to yourself. And so some participants were really aware that people's circumstances, while trying to exist and survive unsheltered, can in fact drive some of these perceptions of them as having mental illness, as having substance abuse, in large part because they're not getting their basic needs met of sleep and sleep in a secure and safe location. So lastly, before I turn it over to Brian, the last theme that really came out in our focus groups kind of across the board was a narrative or a distinction amongst folks who are experiencing homelessness, that some are deserving of services and help and sympathy, and that other folks who are unsheltered are undeserving of any of those things. And a lot of the narratives where folks started to talk about deserving and undeserving related back to 2 things. One, visibility. So folks started to develop, it seemed to me in the conversations that we had with folks in the focus groups, that they started to develop this idea of who folks are who are homeless based on who they see, based on who is most visible in their neighborhood. And this person in the first quote even acknowledges, I understand that that's kind of a small subset of the homeless population, but that's the part that we mostly see around here, right? And so that's who I'm going to form my opinions about. And then the last point I'll make is that folks who tended to verbalize some opposition or lack of empathy to people experiencing homelessness tended to break them down into 2 or more groups. And they tended to do so using phrases like situationally homeless, or folks who have fallen on hard times in some way, versus those folks who are homeless by choice or seen as somehow choosing their circumstances. So the last quote I'll share with you is someone who stated that, we have a lot of people living in the streets and alleys that are the most visible part of the homeless population. And probably the worst part is to be visible because it really takes away from those people that are truly in need and looking for help. And that's what the tourists see when they come in, especially if they stay late at night. We have a lot of people that are just simply dangerous and are really a danger to themselves. And it's heartbreaking to see people that are homeless and drug addicted. So with that, I believe I will turn it over to Brian, and I'll keep advancing the slides.
Great, thanks, Megan. So on our survey, we asked whether individuals would support homeless serving facilities in their communities. And we did specifically say in your community. And so we asked about 4 different homeless serving facilities: drop-in centers, emergency shelters, transitional housing, and permanent affordable housing. And as you can see, there were pretty solid majorities for both transitional housing and permanent affordable housing. So the dark bars are no, and the light bars are yes. Less support for emergency shelters and drop-in centers. So in our focus groups, we wanted to dig a little bit deeper and sort of unpack sort of the attitudes behind those. And so we looked specifically at transitional housing and drop-in centers. So when we asked initially in the focus groups, would you support transitional housing in your community? Generally, people were said yes. And they generally said, the homeless are already in my community. These are mostly, uptown communities and beach communities like Ocean Beach. And they're like, the homeless are already here. I'd much prefer they be in housing than they be sleeping on the sidewalk. They weren't really concerned about property values. We specifically asked about that. And most shrugged. They didn't really see, contrary to some narratives that you see in the media, most of our focus group participants really weren't concerned that it would affect transitional housing in their community, would affect their property values. However, many respondents, when they started to talk more about transitional housing, expressed concerns about what type of homeless individuals would be living in this transitional housing. And they were very concerned about who would be allowed to be living in this housing. So just a couple of different quotes. And this first quote ties back to this deserving, undeserving dichotomy that Megan just talked about. So one participant said, so I think that's transitional housing's awesome. And the only question I would have is, it depends on the type of people they serve. Regular people who, not regular people, I don't like that term. What I mean is people who aren't suffering from drug addiction or mental health issues. If they were my neighbors, for instance, I'd want to know what does that environment look like to make sure I can still walk to my car at night without that being a problem. So this focus group participant was really concerned about what type of individuals would be living in transitional housing. And a lot of other respondents really talked a lot about having rules to make sure that only the, quote, deserving homeless would actually be able to obtain the transitional housing and to keep out those, quote, undesirable homeless. And these next two quotes are examples of that. I'd like to think that the housing would come with strings attached, and they would be required to participate in programs to address whatever their particular issue is. If it's substance abuse, if it's mental illness, if it's just a lack of preparedness for the job market, any of those things. There could be additional services that address the underlying causes along with providing housing. Another respondent, there are rules, and if you don't adhere to the rules, you're out. Yeah, and they have to be pretty strict with those rules and enforcing that. A lot of times people are given a second chance and a third chance and a fourth chance, and then it's like you don't learn. With the child, you've just got to be strict with it and enforce the rules. And if you're not going to do it, then you've got to go. So I think all of these quotes really get at this idea of respondents liking transitional housing as long as it's for who they consider to be deserving homeless. As follow-ups to this, we asked about housing first. We originally weren't going to ask about it at all. It wasn't really something that we really wanted to focus on. But given these responses, we would follow up and say, well, what about a housing first approach where people are given housing before they address any of the underlying issues that they may have that's contributing to their homelessness? Respondents generally didn't like housing first. There were a few respondents that thought about it positively, but they generally didn't like it because it didn't fit in this narrative of dividing the homeless between deserving and undeserving. So these are just two representative quotes of responses we got when we asked about a housing first approach. This is the sort of facility that employs a housing first approach that we're describing, where there are no requirements about who can get in. I think everybody's mentioned that there's such a vast assortment of types of homeless people. And in a facility where you're going to offer them something and not look at whether they're capable of actually using it and even wanting it. There's got to be some sort of restriction, or somebody's got to look into whether they're really going to even be capable of handling that situation. And of course, that situation means being given a home. Oh yeah, it was about your idea of transitional housing with relaxed rules, and I would not be interested in that for my neighborhood at all. It just seems like it creates an easy target for the crack dealers to go where to go to sell crack at night. And so if it were that type of transitional housing, I would not be interested at all. So they were all in favor of transitional housing as long as there are restrictions on who can actually get that housing. Respondents were actually less supportive of drop-in centers. And they were particularly concerned about loitering and petty crime that could result from drop-in centers. Very few respondents were concerned about major crimes or those sorts of things, but they really were focused on what we could call quality of life crimes. And they saw drop-in centers as places where the, quote, undeserving homeless could hang out. So just to give you a couple of representative quotes here, I don't think it's a good idea for people to just be able to drop it and leave. I think if it's transitional, they're already proven that they're sober, they're clean, that they're really trying to get their life together, that's one thing. But if it's just drop in, doodah, that's going to be a drawing place for people to meet other addicts, and they do their business that way. Another quote, it seems to me that that type of facility, drop-in centers, attracts all types of homeless people, including the scary ones. Now, a lot of respondents really struggled with drop-in centers because I think almost everybody recognized that they were important services to provide to homeless individuals. We actually found very few of our respondents said that drop-in centers were a bad idea or that homeless people didn't need them. But they were really concerned that what the effect it would have on the community. And it led to a lot of discussions where respondents were trying to work through this disconnect between their belief that these facilities were useful with the fact they didn't want them in their community. And I have one quote here from someone who was sort of working through this in their mind out loud. Quote, I used to work downtown next to the Salvation Army that provided those services, and it was not a safe place to be. I can't imagine that would be something that anybody would welcome into a neighborhood with their children playing and they're, trying to raise a family. It's just very difficult to, it's really tough for me because I recognize the need for these services and I want that to exist. But at the same time, I also have a need to feel safe in my home. And those two things are in conflict and that sucks. So this led to some really interesting discussions about where to locate drop-in centers, with some people saying, well, let's locate them out in out of the way places, or let's put them on military bases, or let's put them in rural areas away from population centers. And then other people responding will say, no, I mean, homeless people can't get to them if they're in rural areas out of the way. And then there's a lot of back and forth about, well, how mobile are the homeless? Can the homeless travel to different places to get to drop-in centers? And those sorts of conversations. So a lot of respondents really struggled with that. But generally, the overwhelming consensus among respondents was that drop-in centers were not good in the community because they would attract all types of homeless, not just the, quote, deserving ones. So just to summarize our conclusions, a deserving, undeserving framework served as a foundation for respondents thinking about homelessness. This was the thing that just came up over and over and over again. Most of our respondents agree that some homeless individuals were just people who were down on their luck, who just needed some assistance to get back on their feet, that were homeless out of no fault of their own, and they were happy providing services to them. But they also identified a large segment of the homeless as being undeserving housing. Second, respondents focused on the perceived prevalence of mental health and substance abuse challenges rather than on housing itself. Our conversations in our focus groups kept getting back to, well, we need to address the underlying causes of homelessness, which to our respondents were primarily mental health problems and substance abuse, right? For most of our respondents, housing wasn't actually the central problem facing homelessness. Their thinking was that if the homeless could address their substance abuse, their mental health challenges, their lack of job skills, if only they could do all that, then the housing will follow naturally, right? So there really wasn't much of a discussion about the affordability of housing or what to do about the shortage of affordable housing. It was really focused on these other types of challenges that some homeless individuals face. Third, Respondents were supportive of transitional housing as long as it focused on the deserving homeless and had rules to limit unwanted behaviors. We had very few people that were unequivocally opposed to all homeless serving facilities in their community. In fact, I think we really only had one person who fit into that category. Almost everybody was open to some type of facilities with qualifications. And then finally, respondents were generally opposed to drop-in centers because they feared it would attract the undeserving homeless. One of the characteristics of drop-in centers is you can't make a distinction between different types of homeless. They're open to everybody. And so respondents, I think fed a lot of the opposition to drop-in centers because there's no way to prevent the quote undeserving homeless from using them. So just to wrap up, a couple of policy recommendations. Addressing community opposition to homeless serving facilities requires engaging residents and challenging this deserving, undeserving logic that seems to drive those perceptions. And I think one way to do that is to educate the public about the logic behind housing first. Very few people in our focus groups were aware of that logic. Very few of them thought about this idea that providing housing to individuals may help them address the underlying issues that they may face, and that in fact providing housing may be one of the best ways in which to help people back on their feet, and that it makes sense to provide the housing first. That just wasn't the way they thought about housing, right? They had this causal logic that went from first people had underlying problems like a substance abuse or a mental health issue or a lack of job skills or whatever, and that led to housing. They never even considered that the causation could run the other way, that becoming homeless could, for example, exacerbate mental health issues, or becoming homeless could exacerbate substance abuse problems and so forth. So I think there needs to be some education there about why we would decide to give housing to individuals first as a way to help individuals who are experiencing homelessness. Third, I think there needs to be a case made that all individuals need housing regardless of their life circumstances, that everybody deserves housing, even if they happen to have a substance abuse, or even if they have a mental health issue, or even if they've done something, made some bad life choices that may have contributed to their homelessness. That I think that there needs to be a conversation about that really challenging this deserving, undeserving narrative that was so ingrained in how people thought about it that they weren't even questioning it, right? In our focus groups, this was just taken as given, that of course they're deserving homeless and of course they're undeserving homeless. And I think having to make a case that all individuals, regardless of who they are and the decisions they've made, that they are deserving of housing. And then finally, inviting diverse views to the conversation. I think a lot of our focus group participants would really benefit from hearing from individuals who are experiencing homelessness or who are formerly homeless, and especially those that may have been homeless because of poor decisions they've made in their lives, just to humanize those individuals. Often substance abusers were talked about as if they were, pure evil, and they were just awful people that didn't deserve anything and didn't deserve a second chance or didn't deserve to have stable housing and so forth. So I think having those difficult conversations of where, community members are exposed to those types of views, I think would be really valuable. I think what would not be valuable is simply trying to explain to individuals that there are some homeless individuals that are homeless out of no fault of their own. Because I think everybody in the focus groups actually recognized that. Everybody recognized there were some homeless individuals that they labeled as, quote, deserving, that didn't have substance abuse issues, that didn't have mental health issues or things along those lines. I think what needs to happen is having those difficult conversations about challenging this deserving, undeserving dichotomy. So with that, we'll end, and thank you all for coming, and we're looking forward to your questions.
Thank you, Brian, and thank you, Megan, for a wonderful study. I did notice a couple of comments, but also they could be questions as well, which Megan, you answered one of them. It's by Lori Saldana, and she was highlighting how the public doesn't realize the cost of the public health cost of people being homeless and being hit by COVID-19. And she linked us to the San Diego County Health and Human Services, where we could see the breakdown, of course. What do you both think about this? Like, what is, I know you don't have the cost exactly, but um, how is the population looking? Are they thinking about the public health cost, or they're not really paying attention to it?
Yeah, we actually didn't get too much conversation about costs. Now, granted, we didn't raise it, so it wasn't something we specifically asked about. But yeah, it wasn't something that our focus group participants, it wasn't foremost in their mind. They were, I mean, I think, and Megan may jump in here on a slightly different interpretation of this, but I think that for most of our focus group participants, if they felt that something was going to be valuable to help homelessness, they would be willing to spend the cost on that. It's just, I think they disagreed over what would be best to help the homeless, from say what a lot of policy scholars who study homelessness think would be the most cost-effective way.
Yeah, I agree with everything that Brian just said. I would say my recollection is that in the focus groups, views expressing concern about people's health and well-being were very much in the minority. And that, in my mind, really stemmed from these very kind of individualizing and criminalizing labels that folks put on people who do not have housing. And so it seems like another lift to get folks to see kind of the broader public health connections. And I just responded to Lori when she made that comment, that she's spot on. And we also see it. I'm currently obsessed with getting more public bathrooms in the San Diego region, and there is a whole lot of opposition to public bathrooms, and people get very upset about it. People are calling their policymakers all the time. A local policymaker recently told me that they get 50 calls a week complaining about public bathrooms. And yet, 4 or 5 years ago, we had a hepatitis A crisis here. So we have really, it was very clear in the narratives in the focus groups that folks have really separated out kind of community or public well-being with how they think about homelessness. And I think one of our messages here to you tonight is that we need to figure out ways to bring that back together.
Yeah, and just to add on the public bathroom issue, I mean, I think that's again another type of facility where you can't discriminate against the quote deserving versus quote undeserving homeless, right? They're open to everybody. And that I think is why, if there's a way to public bathrooms where you could restrict what type of homeless individuals could use them, I suspect a lot of our focus group participants would be more than happy to support that. I mean, it really was, because I think Megan's right, for a lot of our focus group participants, they weren't thinking primarily about the health and safety of the homeless, although they did show a lot of compassion to those homeless individuals that they deemed were deserving, right? So they were, I wouldn't want to give the impression that our focus group participants were like heartless and they were like saying, oh, all homeless people, we couldn't care less about them. They cared about a segment of the homeless. They didn't really care all that much about another segment of the homeless.
Oh, wonderful. One thing that I noticed, and I'll go through a couple of questions, and I see Lori has her hand up, and I'll come to you, Lori, in a second, is this discussion of deserving versus undeserving. And I think Colleen Cusack highlight this with the idea that deserving, undeserving stem from just deserts philosophy. People who have housing feel they deserve to be housed, and in just society, only those undeserving would be homeless. But building on that just a little bit, if I may, Colleen, do you think that, and this kind of relate to what you were saying, like, have we created a culture or norms whereby we perceive or we stereotype homeless individual in these categories. Um, and how easy is it to change this culture or these norms?
You know, at times during these focus groups, I felt like I was back in the 1980s, because it really is. I mean, there's a very famous study done in the 80s called The Deserving Poor. And it was really during that era, the Reagan era, where this distinction between deserving poor and undeserving poor really solidified, right? And sort of making those types of distinctions, and Reagan's, comments about, welfare queens and whatnot. And it is, I think, really ingrained for a lot of people, about making this distinction between people who deserve public assistance, any type of public assistance, and people who don't deserve it. And it's very ingrained in a lot of our social welfare policies, right? Whether you're talking about work requirements for Medicaid or other sorts of things. So I actually think these are really deep core beliefs of a lot of people, who, and scholars tend not to accept that dichotomy. I think it's a real disconnect between scholars who study homelessness or assistance to low-income individuals generally, and the public at large, who just have this very core belief that you can distinguish between those low-income individuals who are deserving of public assistance and those who are not.
Yeah, very good. That's perfect. I do see some comments, of course, that are coming in the chat, and I know when you're talking, you can't see all of them, but it all talks about the messaging. For example, with Glenn Hilton talks about that, and then Glenn also continues discussing it. But just because Lori had her hand up, oh, I don't see her hand anymore. But I think Lori was mentioning that um, at her request, support building public restroom in public park was added to the local democratic issue platform this week as a statement of value. And I think that's how change happens. And I think that's very important. Can you elaborate a little bit on what people have been raising issues about as well? Like basically talking in support, which is community engagement and education is critical. Have you thought of like mediums to achieve this, or tools? And I know I'm putting you on the spot, and it's not part of what you have done, but just a few brainstorm about it.
Megan, did you want to jump in, or you want me to?
Sorry, Muna, I was reading all the interesting comments in the chat. So your question is about kind of what we should do next?
Well, I think some of our participants were raising the issue of like that what you both propose in terms of community outreach and education is very important.
Mm-hmm.
And I was wondering if I could take it a step further. And have you thought about tools that you could use to engage the community more? Or maybe it's the work of everyone who understand about these issues. But did you think about some medium? Would you, like, for example, do an outreach by the city? Should there be outreach by service providers to the communities where they are? Like, have you thought about it?
I think that the people who need to be doing this work right now are not the usual suspects. So I think we need to hear policymakers articulate informed, evidence-based, and compassionate views on homelessness, and to do so bravely, because it is still an incredibly hostile environment when we're talking, even locally, politically. Homelessness is, back to Brian's response to your previous question, our status quo thinking is that we can police our way out of it. And so when I was listening to folks' focus group responses, I just kept thinking about how these narratives can, in the moment, turn into a call to the police to complain about someone in their community, right? And so I think that we really need to have people, I don't know who these people are, but they're not service providers and they're not advocates, because these folks have been doing this work all along. We need a larger coalition of housed residents, ideally homeowners, doing this work. They need to show up, and it needs to be an anti-poverty, pro-housing, homeless, housing as a human right, I think Colleen put in the chat. And I think that it needs to be at the very micro neighborhood level. Because the other thing we heard is folks having very specific concerns about their neighborhoods and the role that their neighborhoods should play in addressing and contributing to solving homelessness. And so I think that there needs to be that work. Perhaps, you know, we sampled through community planning groups. I would love to see some interventions happening there, where folks start to have real conversations around breaking down this deserving, undeserving narrative. But until we really break out of and get past this criminalization that we're doing and this reliance on police as first responders to homelessness, and all the things that drive that from the community side, we're going to keep repeating the same mistakes. And I see Lori just put in the comments that we need a new non-911 number that folks can call when they're in crisis for psychiatric emergencies and to assist people experiencing homelessness. I think that would be a wonderful place to start.
Wonderful.
And just to add to Megan's comments, so I think the conversation we had during these focus groups was much more constructive than what you typically see in public hearings on these subjects. I mean, and what was different is that during the focus groups, people were willing to engage different ideas and really think about the ideas. So yeah, they were fairly negative about housing first, but they did listen and they did engage with it, right? And that's not something you often see in public hearings. People just come to the public hearing and say, no, this is terrible, go away. But people in our focus groups, they were willing to engage. And I think that if you structure the community outreach in a way that allows for that engagement, I think people will. There were very few focus group participants that were so set in their views that they wouldn't be willing to engage with views that they disagreed with. Most of them were willing to engage. And so I think, so that's the optimistic part that I took away from these focus groups, is that, you know, even though there were a lot of things that they were saying that I felt were really problematic, I was optimistic about their willingness to think through these issues, willingness to consider different issues. And they weren't, again, there were very few people that were absolutely 100% opposed to all homeless serving facilities. I think for most of our participants, under the right circumstances, with the right arguments in favor, they would support these facilities in their community. So I think there is optimism there, hope for optimism there.
Wonderful. I'm gonna just wrap it up with a final question, but this question is gonna take you a little bit back in your study, if I may, which is a little bit not very logical to go back and then haven't talked about what we need to do. But last week in another study talk, Dr. Peggy Peedy was talking about individuals on the street have experiencing sleep deprivation. And I think you both mentioned this, and one of your participants, I think, mentioned that this idea that you are on the street and you experience the sleep deprivation. And we have talked also, you have talked about drug usage and alcohol use. And I was wondering, as in your study, to what extent have people been able to separate that homelessness might have caused all of that versus that they had it before? Because it's very hard to untangle that. If you don't mind elaborating, this will be our last question. Then we'll wrap it up so that we can respect everyone's time, of course. But please go ahead.
Yeah, I guess I'll start. They generally didn't think of that way. Again, the causation generally ran from people had some sort of underlying problem and that caused their homelessness. they never really thought about how like sleep deprivation, if you're homeless, may lead to an exacerbation of mental health issues or whatever. And also too, there were, not everybody, but there were a lot of people in our focus groups that had this idea that there were at least some homeless that want to be homeless, right? They want to be on the street. It was by choice. And actually on our survey, we found a very large percentage of people thought about, that a large percentage of respondents thought that there were some homeless that actually just want to be homeless. They don't want help. And so I think there certainly needs to be some education around that as well. And to try to explain to individuals, explain the behavior of homeless individuals to housed individuals, and explain why a homeless person, for example, may choose not to accept an offer of shelter, or an emergency shelter, or other sorts of things along those lines. Megan, did you want to add to that as well?
I think the only thing I would add, Brian really covered it really well. In our focus groups, we had some people who had had direct or vicarious experiences with homelessness, and those folks articulated a really elevated level of awareness. This is what Brian's talking about, right? And so I just keep going back to exposure and education as being a real critical next step. Because as I loved doing this research with Brian, because he is so much more optimistic than I am about this topic, and it has inspired me to try to do better, to be more optimistic. So for me to even say that education will work, or we should try it, is huge for me. But it needs to happen, and I think we've seen those effects in the folks who shared their experiences with us through the focus groups, where their lives had been touched by this issue in some way. Those were the folks who connected lack of sleep to mental health and those sorts of things. So we need to do more of that.
Well, that's wonderful. Yeah, you're right. What, not the situation is wonderful, of course, like the answer is wonderful, of course. No, that is really very interesting. And I remember, Megan, in one of the studies that you've worked on, where some people have even assumed that they don't want help because there is this, what they call internal locus of control, where people think it's their fault that they ended up being homeless, and not like sometimes that the system itself has led them to be homeless. And that was one example of like how they were saying, like, I don't want the help, I should get out of the system by myself, while we know that sometimes the systems are themselves stacked against people. And it's going to be very interesting to see now, well, interesting in a sad way, and hopefully not sad, but to see what will happen after the COVID eviction moratorium is going to end. And we'll see if people hopefully would not experience more homelessness. That's going to be a big issue that will come up in the coming couple of months. With that, I think since it's 5:58, we don't have any more time for additional questions, but thank you so much both for this presentation. We have already posted, by the way, on the current one, sevi.sdsu.edu. Oh, perfect. And Carmen has also posted it, the presentation for what we're doing for this presentation. And so I hope you go check it out and check our future Sevi talk. And with that, I leave the last words for both Megan and Brian.
Well, just thanks to everybody for coming. It was a really good conversation. And hopefully we'll be doing more research on this and connecting in the future.
Thank you, everyone.
Thank you all. Thank you all so much. And I would challenge you to go out and find someone to educate around these issues. I know I'm preaching to the choir, but if you're someone who doesn't usually do that, please do. Thanks all.
Bye.